All right, so welcome to our DMC mandated reporter training for 2021. This first slide has a short clip in the background of some wildflowers blowing in the wind. Just want to start us off with a peaceful state of mind. Next, I am going to share a content warning. As Larry mentioned, this training will discuss abuse and neglect. It will list specific types and examples. And I'm recognizing that this may be a difficult topic for some people. Please take a break if you need to and come back when you're ready. This training is being recorded and you guys will also get a written outline to review as needed. So what is a mandated reporter? Under California law, to be specific, the Welfare and Institutions Code, section 15630, a mandated reporter is a person who, because of their profession, is legally required to report any suspicion of abuse or neglect to the relevant authorities. These laws are in place to prevent elders and dependent adults from becoming abused and to end any abuse or neglect at the earliest possible stage. So I have a question for you all. Feel free to unmute yourself or pop it in the chat if Jose could help me out with reading the chat. But our first discussion question. So who at DMC is a mandated reporter? What do you guys think?
Everyone.
Everyone, that's right. I think that was Ivan, thank you. Everyone who works at DMC is a mandated reporter, regardless of what your job is here. So this training is for everyone. So we talked about how mandated reporters are there to support and help protect elders and dependent adults. But what does that really mean? So an elder is anyone who's 65 years or older. And for elders, there's no requirement that they are a person with a disability. A dependent adult is any adult between the ages of 18 and 64 who has physical or mental disabilities that restrict their ability to carry out activities of daily living without assistance and or protect their rights. So this would also include some people who are in 24-hour health facilities like a hospital, a psychiatric hospital, or skilled nursing. If you're not sure if someone you're working with is either an elder or a dependent adult, you can always try and make a report to the appropriate agency and they'll let you know what to do in that situation. So if you're not sure, just move forward and ask. I want to check in and see if there's any questions at this point, just because I went over some really technical information. Feel free to unmute yourself or drop questions in the chat. Okay, so far so good. So what are the responsibilities of mandated reporter? If at any point in your work with a consumer, an INR, someone you're meeting for the very first time, anyone that you come in contact, if you suspect abuse or neglect, either because you saw something, you learned something, they told you something, or you just had a gut feeling based on the situation, and that suspected abuse fits within our California definitions, which I'll get into a little bit later, you are required to make a report. A lot of times people aren't sure if they have to make a report if they don't know whether or not the abuse or neglect actually happened. It doesn't matter. If you have a suspicion that abuse might have happened, you are required to make a report. And again, if you're ever unsure, just go ahead and make the report. You can always call the appropriate agency, whether it's Adult Protective Services or some of the other agencies we'll talk about in a bit, and ask for guidance. And of course, you should always inform your manager of the situation whenever you're making a mandated report. So we're talking about abuse and neglect, but it's important to know who are the people who are actually making the abuse happen, or perpetrators, as they're sometimes called when we make reports. So really, an abuser can be anyone. And a lot of times the person who's being abused or the victim knows that person. They may even know them very well. It can be their spouse, their partner, one of their children, a grandchild, siblings, their caregiver, or it can even be a complete stranger. Sometimes we hear about older adults or people with disabilities who are taken advantage of by people like telemarketers or someone pitching a scam. So just another content warning for you. I'm going to share several definitions of abuse and neglect. And if that is uncomfortable for you or too much, please step away and take care of yourself however you need to. So how do we define abuse? First, we have physical abuse. So this includes anything such as slapping, hitting, beating, bruising, or causing someone physical pain. It also is considered physical abuse if someone is suffering or at risk of death. Sometimes people are abused by being confined against their will, like being locked into a room or tied to furniture. And it can also include inappropriate use of physical or chemical restraints. Another type of abuse, of course, is sexual abuse. So under law, sexual abuse is a form of physical abuse, which includes physical force, threats, coercion, or any type of activity that includes non-consensual touching, fondling, or intercourse. Anything that's not wanted or consented to. Some other types of abuse and neglect. The first one is caregiver neglect. So this would be the failure of the person who is supposed to be providing physical, emotional, or to social needs of dependent adults. Sometimes caregiver neglect looks like withholding food or medication or not taking someone to medical appointments. Another category is self-neglect. So this is when the individual is failing to meet their own needs for either physical, psychological, or social aspects of their life, and it threatens their health, safety, and well-being. So maybe they're not able to provide adequate food for themselves, adequate clothing, shelter. They're not able to manage their own health care. And sometimes the more severe cases of hoarding that we see with our consumers will fall into the self-neglect category. Another one is financial abuse. So this is the misuse, mishandling, or exploitation of property, possessions, or assets of adults. This also includes if someone's financial assets are used without consent or through force or manipulation. An example here would be someone used the consumer's credit card without their knowledge, or they forced them to pay for things that they were not consenting to pay for. Next, we have what is called isolation. So this involves restricting visits from friends or family members. It can also be the prevention of telephone contact or even keeping someone from getting their own mail. Abandonment. So desertion by anyone who has assumed caregiving responsibilities for an elder or dependent adult. The caregiver, the person responsible, just leaves. Abduction. This is not something that I have personal experience with, but maybe some of you have. This is when the person, the elder or dependent adult, is removed from California or restrained from returning to California, and they don't have the capacity to consent for either being removed from the state or forcing to stay out. Then we have psychological abuse. So this is any actions that have to do with creating fear in an individual, agitation, confusion, things that lead to them being severely depressed, or other forms of serious emotional distress. This can include threats, harassment, and intimidation by the abuser. And unfortunately, this is the most difficult type of abuse to prove or substantiate. It's difficult because you can't always see what has happened, if that makes sense. All right. So those are the specific definitions of abuse and neglect under California law when it comes to our responsibility for being mandated reporters. Are there any questions about those categories at this point? Chat has a question?
Okay, I have a question. Okay, I missed an important verbal abuse is also very common. Verbal abuse. I just wanted to add that.
This is, yes. So I believe, sorry, there's some, just a reminder to me if you're not asking a question. So
No, I wasn't. I just thought it should be added on the list for verbal abuse. That's all.
this is Brittany. That there was some background noise. So I was just reminding everyone to mute themselves if they're not asking a question. But in reference to your comment, yes, verbal abuse is a type of abuse, and it is included in the category of psychological abuse.
Right.
Yes. So these are very technical terms, very technical categories, and this comes directly from the law, the WIC law that assigns us our responsibility as being mandated reporters. So we may call some of these things differently in-house or as we're communicating with each other, but these are the more technical terms.
Pamela, this is Jose. Pamela did share a comment. She said that's challenging, but that's what we need to stay aware about.
Yes, definitely. Thank you, Jose and Pamela. Okay, so what are some signs of abuse and neglect? It's one thing to know the definitions, but how do we even begin to understand or realize that someone might be in a bad situation? So here are some common things that might hint that something is not okay in a person's life. If you happen to notice any unexplained injuries like bruises or cuts, broken bones, maybe the person looks malnourished or they have unexplained weight loss, poor hygiene. They're showing symptoms of anxiety, depression, or they seem very confused. They might have unexplained transactions or loss of money, or they might not understand or know where all of their money went. Sometimes people who are being abused will withdraw from their family members or friends. So they'll stop connecting, they'll stop reaching out, responding. If they happen to have physical issues like bed sores or infections that are not explained. Maybe their living condition is unsanitary. Things are just dirty. Maybe there's bugs, clothes, or issues with hoarding and clutter. Another sign might be that they're not wearing the appropriate clothing for the weather. So maybe it's very hot outside and they're not wearing the right clothes for the temperature. Some things to look out for. Okay, so an important part of being in human services and being a mandated reporter is knowing how to support someone when they are in crisis. This is not directly tied to being a mandated reporter, but it is connected and it is important. So if at any point you're meeting with a consumer or an INR, or it could be someone that you're just talking to for the very first time, if they happen to share that they are either suicidal or they have a plan to harm themselves or others, you should do everything possible to stay connected with that person until you can inform another appropriate entity who can help. If we're in person, we do not want to let that consumer, that person leave the building until we've provided appropriate resources. Right now, we're all working virtually, right? We're all working from home. So while we're at home, if you have this person on the phone, it's not a good idea to disconnect. It's not a good idea to put them on hold if you can help it. The best thing to do is to connect them to what's called the Crisis Assessment Team, or CATs. Sometimes the consumers might be open to making that call together, but if they're not, just keep talking to them, just keep listening to them, and at the same time, reach out to someone else who can help get you connected. So this might look like seeking the support of your manager or another coworker to contact CAT or the Crisis Assessment Team. You may have to text somebody, you may have to shoot a quick email, however it is that you can get a hold of someone to provide support to you in that situation, so where you're not getting disconnected from this person in crisis. And I'm going to share a bit more about CAT, the Crisis Assessment Team, the information, how you can find them when we talk about where to make a report. I think I saw there was a hand raised, but I don't know who it was.
Emily, I think it was my hand. I raised it, but I didn't know if now was a good time for questions. But I guess my question is, so in this scenario, regardless if they have a plan or not, if suicidal ideations are brought up, we to make the report.
Yes. But what's important here is this person is actively in crisis. And if we disconnect from them, if we let them physically leave from where we are, or if we hang up or put them on hold, we might not ever be able to contact them again and get reconnected. So it's really important to do everything in our power in that moment and connect them with the appropriate entity that can help. We are not trained to support someone in a crisis. We are not mental health service providers. However, we are responsible to connect them with the right support.
Okay, thank you. I just want to clarify.
Yeah, good question. I guess I'll check in now and see if there's other questions. Jet? Jet has his hand raised.
Just so you know, somebody put me on spotlight, so I cannot see Jet or Pamela at all.
Okay.
I put you on spotlight so that the recording spotlights you along with the presentation.
Right, but because it's on spotlight, I can't see the other participants who need interpretation.
This is Liz here. I can voice for Jet. I can see him.
Okay, perfect. Thank you, Liz, for joining.
So Jet, you had a question? This is Brittany. I'll just go ahead and add that this particular training, I'm not going to get in depth with handling and supporting someone in a crisis. There are resources and past recorded trainings that Dell McIntosh Center provided that go into way much more detail than what we'll talk about today. And the links where you can find those trainings will be provided to you. Okay, so the next part of this training is interactive. We are going to review some scenarios together. And the reason for this is it can be really challenging to sometimes know how to handle a situation or know what level of suspected abuse or neglect is reportable. And the scenarios that I'm going to share, unfortunately, are based on true stories. These aren't anything that I had to make up because these situations really do happen. So I'll go ahead and share the scenarios. There are a total of 4. They will be up on the screen and I'll read them out loud and then provide an opportunity for you all to chime in and share what you might do in this given situation. So scenario number 1, we have an 86-year-old consumer who lives alone and they tell you that they have not been able to eat every day. They're no longer able to go to the grocery store independently, and their caregiver stopped showing up about 3 days ago. Is this abuse or neglect? And what do you do? So feel free to unmute yourself, chime in, or drop in the chat what you would do in this situation. And if it's abuse or neglect. Nobody?
Lonnie and Nancy are saying neglect. Pamela shared. That's a good question. Danielle saying neglect, and Marisol caregiver neglect.
Okay. Thank you guys for chiming in. My notes disappeared, so just give me 1 second. I'm sorry. Darn. Okay, that's fine. Yes, so this is definitely caregiver neglect, also potentially abandonment, because the caregiver just stopped showing up, and maybe even some level of self-neglect. So what would you do?
Lonnie shared that she will try to help resolve and get a care and also call APS. And Marisol shared that she would have someone do a wellness check.
Okay, yeah, those are great answers. So we definitely don't want to just make a report, right? This is reportable. This is something we're responsible as mandated reporters to report to Adult Protective Services at the very least. If this caregiver is an IHSS or in-home supportive services provider, we would want to notify IHSS. We also want to provide some resources to make sure that this person can continue to eat and access food. Not just about making the report, it's also about making sure the person has what they need within our ability as service providers at Dell Macintosh. So great job, guys. Good feedback.
There's 2 more comments. Ivan said the first step he would do is contact the manager and then contact APS. Ruth said find out caregiver agency and report it to the agency too.
Perfect. Yes. And thank you, Ivan, for that reminder about bringing your manager into the situation, notifying them, and asking for advice as needed. Good stuff. Okay. Number 2. So a consumer tells you that their family will not let them leave their bedroom except to go to the bathroom. The family members constantly call them rude names, and if the consumer tries to leave their room without permission, they are either hit or they have things thrown at them. Is this abuse or neglect, and what do you do?
Everyone in the chat is saying abuse and report to APS.
Yes, yes. Different types of abuse happening here, right? Physical abuse, psychological abuse. This person is living in an unsafe environment. So in addition to making a report to APS, we probably want to try and help them find another place to live. If they're open to that, maybe they're open to looking for transitional or emergency housing. And in these types of situations, it's really empowering for our consumers if we offer to make the call with them. And we'll talk more about that in a bit, but someone in such a difficult situation where they feel like they have no control, giving them that little bit of control to make the call and support them can make all the difference.
Ruth also shared that would you possibly contact the local authorities?
You could. I would start with APS and see what they advise, if they think it's worth reporting over to the police department or wherever appropriate. We also don't know this person's disabilities. We don't know if they are under conservatorship or any type of legal situation. So there's definitely more information that would need to be found out to see what additional steps need to be taken. Good point. Anything else for number 2?
This is Paul. Can you hear me?
Yes. Hi, Paul.
Hi. When you mentioned the part about a person not being able to leave the room except to use the bathroom, that could also constitute possible false imprisonment as well.
Correct. You're right. So lots of layers to this one, lots of different types of abuse happening. And usually our situations are layered, right? They're not straightforward. It's not a simple answer. So that's why it's important to have these conversations and practice the scenarios. Okay, number 3. So your consumer contacts you and says that they ran out of money for the month, even though they just received their benefits check. The consumer is worried about being able to pay for their rent, and they will not have enough food to get by. You ask some more questions and find out that the consumer's adult child borrowed money to fix their car. Is this abuse or neglect, and what do you do?
Ruth and Olivia are saying financial abuse, report to APS. And Ruth added, look into a representative payee. Everyone else is saying financial abuse.
Thank you, Jose and everyone else. So this is one of those situations where we need to find out more. Anyone?
Brittany?
Yes.
Oh, sorry. I was gonna also say, well, I wouldn't report unless it was something common, because kind of like what you were saying, like you want to know more info, because like if this child is consistently borrowing money and now it's like having them probably close to being evicted, then yes, I would probably report then. But yeah, I just wanted to add that. Thank you.
Thank you,
Brittany,
Julia.
this this is Paul.
Hey, Paul.
I would just say, like you were saying, we would need to be careful with that, because if a person has consensually given or loaned money to somebody else, and that person is of sound mind, then that could be a very difficult situation, unless you could probably show that someone was being threatened if they didn't give them the money. But of course, we do need to report it. It's just with a situation like that, it can get very complicated.
Thank you, Paul. Exactly. So the big thing here is consent, and whether or not this person had the mental capacity to decide to provide that financial support. So you guys brought up good points. Is this something that's happening all the time, or was it the first time? Was the consumer forced or pressured by their adult child to provide this money? Did the child take it without asking, and the consumer's covering that up a bit? There's a lot of layers here as well. If the consumer says they gave the money willingly, and you believe that they had the ability to consent to that, then it might not be financial abuse. It's a good conversation to have with your consumer around independent living skills, creating a budget, having them look at whether or not they actually have the ability to loan someone money or give someone money. And then you also need to address the other areas. This person's not going to be able to pay for their rent. Can we help them apply for rental assistance? What are their options out there? This person's not going to have enough food for the month. What are they eligible for? How can we address that food insecurity? And how can we help the consumer figure out not to let that happen again? If they were forced, if it was against their consent, or you feel like the consumer did not have the capacity to loan the money, then yes, that probably is financial abuse and you should report it. Does that make sense?
Yes.
Okay. Jet has a question. No one's voicing for Jet, so.
Again, Brittany, I apologize. I'm spotlit.
I can
Because
see
I'm
Jet.
on. Yeah.
Liz is here. Go ahead.
Okay.
Thank you. Go ahead, Jet. Go ahead.
Yes. Yes. Hi. Okay, you ready, interpreter? Interpreter, can you see me? Tell him yes. Okay, I get it. I get it. Okay, that's fine. So, okay, Liz is talking good. Okay, so I understand. Okay. If a consumer, are you ready? Okay. If a consumer is, if they're, a Section 8, if they are Section 8, Section 8, but like the two sons join to join their, don't need to. Okay, if they join, the two sons join with them in section 8, then they don't need to tax this. They don't need to. It's not supplemented. It's not supply. It's not. Hold on, we're having a little issue here. I think Jet's typing it up. Not supposed to move in with their mother. Okay, we missed it because Pamela responded immediately to yes, so missed what Jet said. Oh, because they don't have section 8, but only the mother does. They are forced by the mother to accept them. They force the mother to accept them living with her. The result was that the mother lost her section 8 and ended up homeless.
This is so. Jet was sharing an example of a consumer situation that he experienced, where the adult children took advantage of the consumer. Yes, and that's unfortunate. It happens more often than we think. Yes. Okay, so I'm gonna move on to scenario number 4 if we're ready. Okay. So number 4, during a scheduled home visit with a 75-year-old consumer, you notice some formal paperwork on their dining room table. You ask about the forms, and the consumer shares that they were presented legal documents by their adult child who is pressuring them to sign as soon as possible. You receive permission to read through the forms and find a contract for selling the consumer's home and another form granting the adult child power of attorney. Is this abuse or neglect, and what do you do?
Kitchen interpreters.
That sounds like the legal thing, like having to talk to like maybe some lawyer.
So Julia said you might get a lawyer involved.
Yeah, because they already have those documents from an attorney and stuff, or wanting that power of attorney. That sounds like maybe I would want to have them meet with a lawyer to go more in detail about that, because yeah.
That could be one approach. Are there other ideas? First, is this abuse or neglect, and what would you do?
The majority of the chat is saying abuse, financial abuse, and a couple of things that they would do. Juanita is saying if the parent is being made to sign without their consent, then it would be abuse. Lonnie mentioned you would need to determine if it was consensual or agreed upon versus forced or coerced. And Ruth mentioned find out if the consumer is aware what this paperwork is, connect with an agency like Waymakers to ensure they are understanding what it is before signing.
That's all great stuff. Thank you guys. Yes. Either you knew this already or your quick studies. Yes. So consent. That's important in a lot of things in life, but especially here too, right? Just because Just because the consumer shared they felt pressured, it doesn't necessarily mean that they weren't a part of this plan or weren't a part of these conversations. So we would have to determine whether or not consent was there, whether or not they had the mental capacity to consent. So just because this person's 75 years old, age does not determine someone's ability to consent or their capacity, right? There's some people who are 30 years old who don't have that capacity. So we want to make sure that we're taking all factors into consideration. Also, what is this person's disabilities? Are they able to read and understand the legal documents? So depending on all of those factors, you would potentially report to Adult Protective Services if it was financial abuse or you felt they were being taken advantage of. And then of course, yes, get someone else with a legal background involved. Other comments or questions?
Another
Yes, Brittany,
comment by Danielle. Oh, go ahead, Paul.
Okay, thanks. Two things, maybe if you're doing an intake with this person and you think maybe just based on your interaction with them that there may be a cognitive issue, one thing you could do is talk to their emergency contact listed on the intake. The other thing is the Council on Aging has a financial abuse service team. I think it's the FAST program. And sometimes they're able to intervene in those situations as well.
Yes, thank you, Paul. It might be a little sticky if that person's emergency contact is the same adult child who's pressuring them to sign these forms. But if it's someone different, that could be helpful. And
yeah,
Jose, there was something else in the chat, I think you said.
Yes, Danielle just said consent is your friend during that situation. And Megan asked, how do we determine a consumer's ability to consent?
Great questions. Great comments and questions. We're going to talk a bit more about consumer capacity, ability to consent as we get into the training a bit more. So we'll answer it soon. That is our last scenario for a 4. And thank you guys so much for participating in that. I hope that you could see no situation is black and white. There's a lot of gray area. There's a lot of information seeking, question asking that has to be done. And ultimately, again, I'm always going to remind you that if you're unsure, inform your manager and make that report.
Brittany, this is Maggie.
Yes.
I just wanted to add something to scenario 4. If it is very gray, we don't know the details of it, but they could also be protecting her or protecting this consumer, I should say. So I know we like to think the worst of it because of the situation, but it could be that the children are protecting the consumer. So it's like we never know until we get more details and more information.
Exactly. Thank you, Maggie. Most of the time they're not. I'm just going to put that out there. But yes, it's possible. So yes, just your friendly reminder that if you are unsure of what to do, if the situation qualifies as suspected abuse or neglect, consult your manager and make that report. All right. Any other questions or comments at this point?
Brittany, this is Maggie. I have a question.
Okay, Maggie.
Is this the end of the presentation?
No, it's not. This
Oh.
is a 5-minute break.
Oh, maybe I should hold my question till later then.
Okay, maybe write it down or something or pop it in the chat just in case it doesn't get addressed.
Okay.
So right now we're going to take a 5-minute break. We covered some really heavy content. All right, so welcome back from your break, everyone. Next, we're going to talk about when to make a report. So that's a big question that most people have is how soon or what's the time frame? The time frame is immediately or as soon as possible. As a mandated reporter, as soon as you know of suspected abuse or neglect, you should be following through with that responsibility. And we are required to make a report each and every time we suspect abuse or neglect. So if we've been supporting a consumer, there's a situation that happens, we report it to Adult Protective Services or another entity. And then a couple weeks from now, you're talking to that same consumer and they mention a situation around abuse or neglect, you need to report again. Each and every time. I know for most of us, if not all of us, we tend to have reservations or concerns about making a report. It's uncomfortable. It puts us in an awkward position sometimes. Sometimes we're not sure if making the report is going to make the situation better or worse for a consumer. However, if we witness or hear about a situation, we are obligated to make some really difficult and important decisions. So one thing I always like to tell people is our consumers should never be surprised that we're making a report to whatever the appropriate entity is. We tell them about our status as mandated reporters during the intake process, and we can remind them as needed of what our responsibility is. So if a consumer does begin to disclose abuse or neglect, it's a good idea to remind them right then and there. You can say, as a mandated reporter, I might need to bring someone else to this conversation who can help. Sometimes the consumer might change their mind when you remind them and they might stop sharing or say, oh, never mind. And you can probe a bit and not just completely let it go, but you can say, okay, that's fine if you don't want to continue to share, but if you're interested in mental health support or looking for emergency housing or whatever resource you feel might help them alleviate that situation that they're in, try to continue the conversation in a productive way. Depending on the situation, we talked about this with one of the scenarios, you can offer to make the call with the consumer because this can be really empowering for some folks and give them more control when they're in a really difficult situation. If you feel like that's just not going to be a good way to go, then of course don't offer that. But if someone is coming to you and sharing what's going on at home and you feel like they may be open to it, then that would be a way to go. Another thing you can do is you can educate your consumer about the process and what to expect. That way making a report is less scary. So you can tell them, we're going to call Adult Protective Services. They're going to ask them some questions. They're going to want to know your birthday and where you live. And then we'll tell them more about the situation. And they might have some very direct questions for you. And I'm here and I can help you answer those questions if you need help. And you can explain what might happen after you make a report too. Depending on the consumer, that might be really helpful. I know something that comes up for a lot of us, a common fear is we're worried whether or not our identity might be kept confidential. So even though consumers or the people we work with shouldn't be surprised that we're making a report, it still can be kind of scary. We worry if they might retaliate or figure out that it was us. So I do want to share that as a mandated reporter, your identity is protected under the law, the WIC law, section 15633. And if the consumer or the alleged perpetrator, the person that's causing abuse, if they ask if you made a report about them, you're not obligated to disclose at that point. If you follow all of these steps and for whatever reason you feel uncomfortable, you're afraid that the consumer might retaliate, please let your manager know immediately so we can put a plan in place for safety measures. Figure out the best way to ensure that you are safe and protected. Any questions?
Brittany, this is Maggie.
Maggie.
Okay, so are you saying we can choose to tell the consumer we are mandated reporters, or do we have to tell them we're mandated reporters when they're reporting abuse?
You should. You should. So consumers should always know our responsibility and our status. When we do the intake with them, we talk about privacy under HIPAA and we talk about being a mandated reporter. And as they start to disclose something, it's always a good idea to remind them of that.
And so if with some of the reports that I've gotten, I noticed that there is a trend where if I would report that I'm a mandated reporter, they will take everything back they said. They're like, oh, never mind, it wasn't true. Or they'll say, oh, don't you dare report me. So at that point, are we still mandated to report even though they're taking back what they said?
Yes, great question. So even if you're still required to report, even if the consumer takes it back, because you are suspecting abuse or neglect based on something that you heard or a gut feeling that you had. At that point, you don't have to tell them, oh, well, I'm a mandated reporter and I'm going to do it anyways. But you do need to follow through with your responsibility and make the report. Does that make sense?
Yeah, my only fear is of the retaliation. So if I'm reminding them, because I know at intake, I do report to consumers that we are mandated reporters. I do let them know that at intake. However, if ongoing, they mention it to me and I'll make a report, I notice a couple of my consumers would get really upset. Why did you do this? You ruined my life. And so I get fearful of retaliation from the consumer themselves. Because, if I'm saying I'm a mandated reporter and they're like, they're accusing me of reporting, then I actually get fearful of retaliation from the consumer. I don't know if they get upset because I know one consumer got upset because she was so embarrassed of police going to their place. And so I just worry about telling consumers or reminding them, I should say, that we're mandated reporters only because of the retaliation.
Right. Yeah. And so that's why I talked about if you find yourself in that situation, of course, let your manager know. We can put a plan in place. Depending on the situation, that might look different. So another important part of that is language, right? So if someone's disclosing abuse or neglect, you don't have to say, I'm a mandated reporter and I'm going to make a report. You can say, this sounds really serious and I might need to bring someone else into this conversation. Are you open to that? And then you can talk about what those options are. Adult protective services is scary, but they can help in this way, or sharing different resources. So some of it's about how you approach it. And of course, if your consumer is already agitated, not in a great state of mind, or it's not a great situation, then you probably don't necessarily want to give them that reminder right in that moment. So these tips all vary depending on that situation for each individual.
No, that's great advice. My final question is, once we make a report, because it's confidential, do we need to document it in SillSuite that an APS report was made?
Yes, you do. It's not confidential when it comes to the consumer's file and case notes, and it's important for other staff to know if they're working with that consumer, what's going on, things for them to be aware of, and also for us as an agency to prove that we followed through with our duty of making a mandated report. Because, I'm going to talk about this a little bit more next, but sometimes depending on the situation, it could come back to us. We could be investigated. Other questions before I move on?
Danielle had a comment saying, love the strategy of educating the consumers on the mandated reporter process and try to have a calm approach.
Yes. Thanks, Danielle. Okay, so what happens if you fail to make a report? This is something that I learned. I did not know this. There are very severe penalties for failing to make a mandated report when you know about suspected abuse or neglect. So under the Welfare and Institutions Code, the WIC code 15630, if you fail to report, you can be fined up to $1,000 or 6 months in jail or both. And if that failure to report results in great bodily injury or death, that penalty increases to a fine of up to $5,000 and 1 year in jail or both. This is very serious. This is why it's very important for us to understand our responsibility, to understand when to report, and to understand what happens if we don't report. And this goes back to Maggie's point about whether or not we put that case note in Sales Suite. Yes, we do. It's a CYA, cover your assets situation, I'll say. Okay, where to make a report. So depending on the situation, you would make a report to one or more of the following agencies. One that we've been talking quite a bit about is Adult Protective Services, or APS. So APS investigates reports of elder or dependent adult abuse that occur in private homes, public settings like restaurants, stores, doctor's offices, or outside of long-term care facilities. So it's important to think about where this abuse and neglect is happening to figure out what entity is the appropriate entity to make a report to. After this training, you will all receive an outline and a handout that has the phone numbers and more information of where you can contact each of the agencies we're talking about. So you'll receive the phone number for Orange County, APS, as well as Los Angeles County. Next is the Crisis Assessment Team, or CAT, C-A-T. So CAT provides 24-hour mobile response services to any adult who's experiencing a behavioral or mental health crisis. CAT conducts risk assessments. They can initiate involuntary hospitalizations, also known as a 5150, as necessary. They also provide linkages and resources and conduct follow-up contacts for the people they assess. Something important to note with CAT, the person may receive a bill after the fact. We've heard about this in some situations. And if a consumer does get billed for CAT services, that cost can be billed to Medi-Cal. So DMC can help them navigate that process as needed. For Los Angeles County, it's called something different, but they do the same thing. Instead of CAT, it's called the Psychiatric Mobile Response Team, or PMRT. And I will share that information with you guys in the email as well. Next, we have the police department. So this is the only agency that can respond to ensure immediate safety and possibly arrest someone if necessary. If there's a crime currently in progress or there's immediate danger to the victim, this is an emergency and you should contact law enforcement by dialing 911. This is such an important note. Police department should always be our last resort. There are higher rates of police brutality for people with disabilities and for people of color. So really consider whether or not it's important. It's an immediate safety issue, an emergency. That is when we would get the police involved, last resort. And I will share a list of all the Orange County local police departments because their jurisdiction is by city. and the same for Los Angeles County. The last potential entity that you could make a report to is what's called the Long-Term Care Ombudsman. So they represent and investigate reports of suspected elder abuse or dependent adults who are in long-term care facilities. And I will share the information for both Orange and Los Angeles County. Okay, we've got about 10 minutes left of our meeting, and I've got a good amount of information. So if there are any questions, they're welcomed, but I may cover some of your questions in the next part of this training.
Brittany, this is Maggie. Hello?
Yeah.
Oh, sorry. So if they don't fall in the category of dependent adult or a senior citizen, would we then contact the police for like a welfare check if they're suicidal?
So if someone is suicidal, you would ideally contact CAT, the crisis assessment team. In that situation, police department can come into play if it is someone who doesn't fall into the category of an elder or dependent adult, yes. Because that would be considered more like a crime person to person. They're not necessarily a protected group of people.
So if somebody didn't fall in those categories, but they were in harm, are we mandated to make a police report?
We are not mandated. However, it's kind of the right thing to do ethically, right? To help someone in a bad situation, especially if they're asking for help.
Only because I had a situation where someone did report to me and a manager that they were in trouble, and the manager at the time asked if they wanted us to call the police.
Right. Because the difference here is if someone's not an elder or dependent adult, we're making the assumption that they have the capacity to give consent.
Mhm.
Able to make a decision as to whether or not they need assistance, whether or not they would want the police department called. Conversation look a bit different. It's not mandated to report that, but again, it comes into the ethics of it and whether or not this person is asking for help.
Interpreter switch.
Okay, so let's talk about the process of making a mandated report to Adult Protective Services. And in 1 or 2 words, does anyone want to share how it felt the first time they had to make an APS report? Not the specifics of the situation, but just in 1 or 2 words, you can unmute yourself or drop it in the chat. What did that feel like? Was it awkward? Did it make your stomach hurt?
This is Socorro. I think it can feel a little intimidating the first time.
Yes, thank you.
Yeah, you got it.
Okay, I think that's a great word to describe that feeling. Making a report to APS is intimidating and it is stressful, but there are things that you can do to help alleviate that stress by being prepared for making that report. So some of the things that are important to know is there's very specific information APS is going to ask for when you make a report. You're going to want to know the name of the person. So even if all you have is their nickname or their first name or their last name, give them the most information you have. They're going to want to know where you saw the abuse or where it was reported to have taken place. They're also going to want to know the address of the person who's being abused if you know it. They'll ask for dates of observed abuse, if there were witnesses or other parties involved. And sometimes they might interview family members, caregivers, other staff members. You're going to want to include your best estimate of the alleged victim's age if their date of birth is not known, any injuries that you saw or are aware of, in as much detail as possible. And this is important because sometimes physical injuries can fade over time, bruises and things like that. You're also going to want to make sure to share if you know if that person has a physical, intellectual, or mental disability or any other risk factors that you might be aware of. For example, the person abusing them will be home again tomorrow. Their relevant medical history or any medications they're taking if you know that. And then once you make the report, there is a required form that we have to complete. It's the SOC 341. I'm not going to review how to fill out that form, but it will be shared with you guys in an email. And that form has to be submitted either by fax or mail within 48 hours. Yes, we are all working remotely from home. So you should contact your manager for support and making sure that the SOC 341 form is submitted in a timely manner. And the form that I'll share with you, it's a PDF, it's a fillable form, it is accessible to my knowledge. Okay, so I want to talk a little bit about what APS actually does. Sometimes people feel frustrated because they feel like nothing gets done or they don't really understand what APS's role is in all of this. So APS's goal, the reason why they exist, is to help the alleged victim be safe and determine if abuse or neglect has taken place. They help with interventions, and their ultimate goal is to help improve that person's life. Something that's very important that I personally didn't know for a long time is that APS is voluntary. So for any adult with capacity for decision making. So if you make a report, APS goes out and investigates, they determine that this person has a capacity to make their own decisions, and that person refuses services. APS cannot force them to move forward with the investigation or agree to any services that might be offered. And there was a question about, well, how do we determine a consumer's capacity to give consent and their capacity to make decisions? That's not our job. We don't have the skill set, we don't have a tool to do that. So it's within our own best judgment. If we feel like through our conversations with that consumer that they are confused or unsure, or some aspects of their disability might impact their decision making, then that's our own best judgment and we would make that report. It's up to APS to decide whether or not that person actually has decision making capacity. So what happens after you make an APS report? They are required to investigate every report. And as you're making that call, during and after, the person on the phone is evaluating the potential risk to the victim, for prior records, have things been reported before? And ultimately, they'll make a decision as to whether or not the law will allow an investigation. So it all comes back to the law. Legally, those definitions, those categories of abuse, it has to fit within those. Certain reports might be prioritized within 24 hours, 1 to 3 days, but most cases will be investigated with a maximum of 10 days. So just to give you an idea of a time frame. The APS social worker will attempt to make contact with the alleged victim, and law enforcement might be brought in if needed or if the investigator is denied access to the alleged victim. And the person who is potentially being abused is always interviewed privately. Other people like family members or caregivers might be brought into for questioning and investigation, but it'll be separate from the person who is potentially being abused. So that's what happens, that's their process. And It's 4:29. I feel so rushed. I will share that there are places that you can learn more. That'll be a part of the document that I send out to everyone. There's the trainings that DMC did around handling crisis. And there's also some websites around elder abuse and things that I found that I'll share with y'all. But for this last minute that we have together, are there any questions?
There is a question in the chat that says, what if they inform you about something that happened to them more than 2 years ago? Would you still report to APS?
Yes, you should. If it falls within those categories of abuse and neglect, if you're not sure if someone ever reported it before, then yes, you should always make that report. And at the time, APS can tell you, you know, this isn't significant, or someone else already reported this, or they'll tell you what to do. But you should always assume that no one reported and make sure it's documented, because every report counts every time. Any other questions? Okay, I want to be respectful of everyone's time and energy. I know this is a lot of heavy content, and we're at the end of some of your guys' day. It's 4:30 right now, so